Good evening, ma'am.
Yeah, Namrata, good evening. Only give me a minute. Just reached home. Just reached home. Only give me a minute. Huh?
Okay. Is this a doctor? Yes. Good evening, ma'am.
Good evening, dear. Nice to see you.
Nice to see you. I Subha event was really like
Liked
registration.
it? Thank
But
you. That is very encouraging. Now, if people like it and find it useful, then it is very encouraging for all of us. Are there any questions which have been posed by audience in advance?
in advance, no. Dr. Ritu may be having, yes.
Okay. I had sent her some certain questions we can discuss as and when things.
मैम आ गई मैं आ गई हाँ 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 आ
हेलो,
गई
आ जाओ.
कैसे हो मैम गुड इवनिंग
बढ़िया,
हाँ
नाइस टू सी यू.
सेम यार मैम मैम पहले ना हम वही लेंगे जो आपके साथ डिस्कस किया है ना जो आपने
हाँ.
केस स्टडीज भेजे मैं आपको
हम्म.
ना ये भेजती हूँ दो चार क्वेश्चन जो आए हैं अभी हाँ मैं आपको भेजती हूँ आप देखो हाँ हाँ
अच्छा अच्छा, ठीक है.
हाँ तो मोस्ट मोर और लेस सेम ही है जैसा आपने भेजा है ना हाँ
हाँ, ठीक है ठीक है ठीक.
तो भी मैं भेजती हूँ आपको मैम अल्ट्रासाउंड से रिलेटेड बहुत सारे क्वेश्चन पूछना चाह रहे हैं लोग कि
हाँ हाँ,
अल्ट्रा
ठीक है
हाँ हाँ
ठीक है ठीक है ठीक है. क्योंकि थोड़ा
देखिए
सा हाँ,
हाँ
करवा
मैं
देंगे.
आपको हाँ मैं
रेस्ट
देखिए आपको हाँ
देख लेती हूँ.
क्योंकि अलग अलग है ना मैम हाँ हाँ मैं आपको मुझे भेज ही देती हूँ एक में करके एक ही मिनट मैम हाँ हाँ एक करना
बता ही देना, अभी तो लॉग इन तो नहीं हुए लोग ना. बता दे.
नहीं नहीं अभी नहीं नहीं अभी नहीं बताएगी ना वो मैं बताएगी हाँ हाँ देखिए
अच्छा
मैम
अच्छा.
मैम ऐसा है कि फॉर इवेल्युएटिंग द ब्रेस्ट लंप इन द यंग वर्सेस ओल्ड पेशेंट व्हाट आर द पॉइंट्स टू बी पॉन्डर हाँ
ओके.
फर्स्ट हाँ
ठीक है.
एंड हाउ डू यू डिफरेंशिएट बिटवीन द बिनाइन एंड सस्पिशियस लम्प्स वाया इमेजिंग तो ये
ओके.
बोलेंगे तो लूं या नहीं तो ना लूं इमेजिंग का है इसमें तो ज्यादा हाँ
नहीं नहीं, बता दूंगी थोड़ा सा, ठीक है.
है ना हाँ
हाँ.
और देन ऑफ कोर्स द विच नीडल बायोप्सी तो वही कोर बायोप्सी इंस्टेड ऑफ एफएनएसी है ना यही आ जाएगा हम एंड अभी ये क्वेश्चन इन लोगों ने मुझे भेजा है ये वाला तो योर प्रोटोकॉल फॉर ट्रिपल असेसमेंट एंड सस्पिशियस ब्रेस्ट लेजन्स
ठीक है.
हाँ
ट्रिपल
एंड
असेसमेंट का मतलब यही होता है, हिस्ट्री टेकिंग, क्लिनिकल एग्जामिनेशन एंड इन्वेस्टिगेशन, जो भी है.
हाँ हाँ हाँ
तीनों चीजें.
एंड व्हाट टू चूज अल्ट्रासाउंड मैमोग्राफी और एमआरआई
वो डिपेंड करता है कि क्या सिचुएशन है उसके ऊपर, बता.
हाँ मतलब ये बहुत कॉमन क्वेरी रहती है ना लोगों की हाँ जी और सो उसके बाद है any genetic testing you recommend for the breast lesions?
वो बता दूंगी, ठीक है.
Importance of the receptor status.
Yes, okay, I'll tell.
हाँ. Um, protocol of managing the breast lesions in lactating mothers.
I'll tell. Okay.
Huh? And how you will approach a patient of breast pain without a palpable lesion.
Good questions.
है ना? तो आई थिंक यही ले
Yeah.
लेते पहले, ये बहुत सारे क्वेरीज जो है ना, वो सबका आंसर भी हो जाएगा. हाँ
ठीक है. As you wish.
हाँ हाँ. मैम तो हमारे ऑलराउंडर है, जो भी बोलूंगी सब बता
अरे
देंगे.
नहीं यार, ऐसा कुछ नहीं है, ऐसा कुछ नहीं है.
हाँ.
ये ऋतु की महानता है, अच्छी दोस्त है ना,
हाय
इसलिए.
हाय हाय हाय. मेरी क्या मानता है मैम.
ये दिल तुम्हारे प्यार का मारा है दोस्तों.
वाह 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 वाह. मेड माय डे.
हम्म. अब नम्रता से भी अच्छी दोस्ती होती जा रही है धीरे धीरे.
चलिए, अच्छी नम्रता ही अब इनका मेडिसेज का करती ना, ये गायनेक वाला पूरा. हाँ.
हाँ.
I'll start preparing for life.
Yeah.
Anita. And we are live, ma'am. Good evening, everyone. I'm Namrita Madesh from MediSage E-Learning Private Limited, our leading platform dedicated to empowering medical professionals through knowledge sharing, expert insights, and digital innovation. And today, I welcome you all to yet an insightful med talk on breast lesions, how to tackle them. We are honored to have two distinguished speakers with us, Dr. Ritu Santwani and Dr. Anita Rajorhia. Dr. Ritu Santwani is a renowned obstetrician, gynecologist, infertility specialist, and a sexologist, known for her holistic approach to women's health. She holds prestigious qualifications including MBBS, MD, FECOG, FIAOG, and Art Singapore. She is the founder and CEO of 360-degree Healthcare Studio in NUHS Singapore, a platform dedicated to comprehensive women's wellness, recognized among the top 50 most influential doctors on social media. Dr. Santwani is also the co-founder of MAAM and a board member of SWWC, where she actively contributes to advancing women's health and empowerment on a global scale. Joining her today is Dr. Anita Rajorhia. Dr. Anita Rajorhia is the head of department and senior consultant obstetrics and gynecology at Dr. Hedgewar Arogya Sansthan, Government of NCT of Delhi. She currently serves as the president of ISOPAP Delhi and Delhi Gynae Forum Southwest. She has been the chairperson of the Adolescents Health Committee and the Reproductive Endocrinology Committee of AOGD and is an active member of Foxy Breast Committee, contributing to awareness, screening, and prevention efforts. She has received numerous awards, including APJ Abdul Kalam Achievers Award, Wanda Foxian Award, and ISAR Champion of Women's Health Award. Experts, we welcome you to the session and request Dr. Ritu to take the session ahead. Over to you, ma'am.
Thank you, Namrata, and thank you, MediSage, for providing the platform for such academic initiatives. So, dear friends, today a very special guest, Anita Madam, is with us. Anita Madam के साथ मेरा कुछ दिल का नाता है, I can say. Huh? So, ma'am, a very, very warm welcome to you. Ma'am, these lovely roses are here to welcome you.
Thank you.
So, friends, as we all know, uh, Madam is doing a lot of work in the field of the breast lesions and the breastfeeding. So, today we thought a topic that why should not we come and discuss the topic related to breast lesions. Related to that, there are a lot of queries amongst all. Not even the gynecologists who are practicing from 10, 12 years, but also in the young gynecologists also. There are a lot of confusions. And in this era, when a lot of youngsters are approaching to us related to some cosmetic issues related to breast, So I thought we will invite Madam today and we'll discuss all these questions for the benefit of all. So a very, very warm welcome to you, Madam, and really
Thank
grateful
you.
to you that in such a short notice you accepted my invitation. So
Thank you, Ritu. And you have really stood to the occasion. You have put pink as background. Pink health means breast health. So pink is the color of even breast cancer awareness. So you must be seeing I'm also wearing a
yeah, yeah, wearing a pink.
magenta
Yeah.
dupatta. So
Uh,
Namrata, thank you for giving us this platform. And I owe a lot to MediSage for giving us these kind of platforms for public and awareness amongst our doctor friends. Thank you so much.
so with your permission, ma'am, we will start with the questions round because once we
Sure.
posted the flyer, we have received a lot of questions. So
Okay.
coming to the first question related to the cosmetic concern, what we have received. This question actually I received just now in my messenger Facebook. So
Okay.
ma'am, this is from Dr. Rohana. Dr. Rohana Motil. Dr. Rohana Motil, she is joining all the way from I'm not able to read what's the place this is. From Kopargaon. Yes, Kopargaon is near Shading. Yeah.
Okay.
She is writing ki, ma'am, a lot of patients are approaching us with a small breast. So, is it any advice we have to give while they are planning for the pregnancy? That is it any problem while they will breastfeed? And one more question she added that is it like that the small breasts are more prone for the sagging? So I want we should
Yeah.
discuss these things. Yeah.
I think the body image issues are of major concern nowadays, especially among adolescent and young girls. So this is a very common query we get from girls. So first of all, we may have to sit with the girl and her mother also that the if the concern is compelling, only then we must go ahead. It depends on the age also, no? So if the girl is still in growing age, the breast will grow over some time. So we have to take into consideration the age, the build, everything of the patient. What is her, current, what is her reproductive age, what is her future intent for reproduction. All this is very, very important in history taking. A good counseling is must because we must counsel these girls that breasts come in different sizes and shapes. So everybody is different. So it there is no though no assigned size or the shape of breast. Every woman is different, so we have to counsel her. And if still you think that she is concerned a lot about her small breast issues, you can advise her breast augmentation. There are many procedures available. Implants are also available. Of course, breastfeeding is not affected by it, and this is not a major issue. She can easily breastfeed the child. There is no problem, but we must tell them these implants last usually for 10 years, and maybe she will need a redo surgery after that. And special care is to be taken of implants. All this has to be told to her. So the pros and cons have to be discussed with the girl and her family also, and accordingly we go about it.
Yeah, very true. Thank you so much for clarifying all this. Now, the another question comes in my mind as just we have discussed related to this small breast. Now, another question comes with a large size breast. As you have rightly pointed out, yes, every woman has a special, unique structure. So there is nothing like that the one is having the small breast, another is having the large breast. So, ma'am, is it like that? Any scientific studies related to that the larger breasts are more prone for the sagging?
As far as larger breasts are concerned, of course, because the mass will be more. So, what causes sagging is age, loss of hormones, and gravity plays an important role. So, if the mass is large, of course, the gravity will have more effect. So, they will, sag. But what happens is when the menopause happens, the fat tissue becomes less. So, the size will become less. But you are talking about scientific evidence. It has been found that women having very large breasts may sometimes have neck pain and backache. So it has been shown that these women who have larger breasts may have this problem because they have to wear special breast support or bras specially made for these large breasts. They have to wear appropriate size of the cup of the bra so that it is well supported. Otherwise, I have seen women who are complaining about these backache and neck said in this thing. It really is a pain sometimes in neck. It can cause if the as far as sagging is concerned, you asked about small breasts also. The sagging is age related, and if the breast is not supported, then and exercises not are not done, then sagging can happen even in small breasts also because of the age, but the result is more marked in larger breasts. So that becomes an issue.
Yes. So thank you so much, ma'am, for clarifying all this. Now coming to the discussion, as we are seeing do you think there are some red flags once the patient approaches us with the breast lump? So I want that you should clarify because this program is very much popular among the resident doctors also. So I want that because there is some query in the young practicing doctors also. Once the patient approaches us with the breast lump, so either of the young age and of the older age also. So is it some things that should on the button on the that this may be a cancerous? So I want that you should highlight about that.
Yeah. So whenever a patient with breast lump is coming to you, so you have to consider many factors. Age. Age is important. A woman who is, of elder group are more likely to have malignant breast lumps. But younger and adolescents will have more fibroadenomas or benign breast disease. As far as history is concerned, if you take a proper history, is the lump increasing in size? Is there any sudden pain which has been noticed by her? Has she noticed any change in shape or size of the breast along with the lump? Any discoloration of the skin? Any puckering of the skin? Any nipple discharge associated with it? So, all these things have to be taken into account. And then you will do the good clinical examination. History, red alert, as you talked about, is blood stain, nipple discharge, sudden increase in lump, or pain in lump, or the skin has become puckered. So these are red flag signs. As far as examination is concerned, the freely mobile masses are usually benign. It's not a rule, but most of the freely mobile lumps, smaller lumps, are benign. And the malignant lumps will be either fixed to the skin or to the lower tissues, the tissues which are lying underneath it. Or there may be associated nipple discharge. You will not be able to move the lump, and the patient will give you history of sudden increase in size also of the lump. All these things have to be corroborated together, and then you do the radiological imaging because it comes under the triple assessment: examination,
My next
radiological,
question was related to that only. Yeah, yeah. So, yes,
and
what is the triple testing? Yeah, we use this word triple testing. So, what we should include in this? And I want that you should highlight the points. Is it like that? At what points we, as a gynecologist, think that we have to refer that patient to either to a oncosurgeon or a surgeon?
Okay, thank you for that question. So first of all, let us discuss about triple testing. I told you about good clinical examination. Clinical examination means examination which is done by the attending doctor. It may be a gynecologist or it may be anybody. Breast, everybody should know how to do clinical examination of breast. You see the shape, size, lump, fixity of the lump. Are there any associated axillary lymph node? Is there any associated nipple discharge? What is the contralateral breast looks like? So you have to do the proper examination of breast. Then if you're suspecting anything, then you subject the patient to radiological imaging. It may be ultrasound in younger patients, or it may be, sometimes you may need to do other tests also like MRI to confirm the diagnosis at times. And mammography nowadays, digital mammography is available. It is a very good option for women to undergo. and it can diagnose so many of lumps. So a mammography which is done only for screening is called screening mammography. But if a patient is having lump and you are doing a mammography, then it is called diagnostic mammography. So usually digital is done. Digital means the X-rays are taken. One is, vertically, and other is from the axilla, so that, axilla is not missed. Is
Correct.
there any, yeah, lymph node? It will become visible on mammography also. So both the breasts are mammographed. And then the third part, the triple testing, the third part is taking the biopsy. Nowadays, FNAC is not done. It is the core biopsy which is done. If the woman is worried nowadays, we have, vacuum aspiration biopsy
Yeah,
is also available, and it can be curative also sometimes. If the lump is small, the whole lump can be aspirated and sent for biopsy. So this comes under the triple testing. Now you talked about when to refer to oncosurgeon. Breast
yeah,
was initially a domain of gynecologists. Later on,
yeah.
gradually it shifted to general surgeon, and now we have specific breast surgeons for the same. If you find that the mass is large, or it is involving deeper tissues, or it seems malignant, of course, you should send it to the oncosurgeon, because the first surgery is the best surgery. And moreover, you will have to counsel the patient if the breast lump turns out to be malignant, and you should give her option of reconstructive surgery also. So I think it's a very, logical thing to send her at right time to the right person, because they will be able to counsel her well regarding surgery, and primary reconstruction can also be done at the same sitting, because these things are available, and our women should know about it.
So very true. We have to take the proper decision at the proper time. So do not delay unnecessarily. If any doubt or any confusion, so in that case, you can consult your senior gynecologist still if there is some problem or we are finding, as the madam has just pointed out. So don't hesitate to refer the patient to an oncosurgeon. Okay, ma'am, coming to the next question. So, related to menopause, so we are seeing a lot of patients having some or the other issues at the time of the menopause. So, do you think there are some important points which have to be keep in mind for at the perimenopause and postmenopause? This is
So,
actually a question received, huh? Yeah.
yeah.
Hmm.
So we have almost covered adolescent and reproductive
Yeah,
age group now. When the women approach perimenopause, the breast size will decrease, but still women should continue their self breast examination. Now
correct.
this self breast examination must be continued if she's not having any previous lump, or there is no specific history for any breast symptoms, but still she should do her self breast examination. And if she finds any lumpiness, or a lump is found of recent development, then she should go for clinical breast examination also. So we should not become like oblivious of our breast issues when we are approaching the perimenopause, because this can happen anytime. The breast lump may develop anytime, even in although the incidence decreases because of the dwindling hormones, but still one has to be very, very careful in self breast examination. Now, this word self breast examination, you have to teach your women how to do self breast examination. Every woman should know how to do the self breast examination. Like whenever you are taking a bath or shower, you stand in front of the mirror, and with soap put on your hand, you can first examine yourself in the mirror. Just look into the reflection, whether your breast looks similar on both sides, the nipples look similar, is there any puckering seen, or you find any protuberance. A lot of things you can see even on inspection. And you can now palpate, you can feel your breast in either circular or like in triangular areas. You can divide the breast in the, like a wall clock is there, no? So you can examine according to triangles also. Or you can do like this. from one side to other, then you can do go down and down and down. And one important thing is first palpation is with this with the tip, the
Yeah,
ventral aspect of your fingers, and first feel for the superficial and then go for the deeper tissues also. If you have larger breasts, then you will not be able to feel for the deeper ones. So you can do that in standing position, sitting position, and even in lying down position. And don't forget to feel for your axilla on both sides, because there is a breast tail, the breast tissue extends into the axilla. We should not miss self-examining that also. So if you find any lump, then she should go to the doctor who will do the clinical breast examination and subject her to triple testing, as we have already discussed. The protocol will remain the same. The screening mammography may stop after some time, but if the expected life is still 10 years, she should continue to get mammography at least alternate years in
yeah,
perimenopause.
yeah. Thank you so much, ma'am, for such a elaborative answer. Ma'am, coming to the next question, as we have just pointed out about the axilla. Ma'am, there are some patients are coming with this accessory and axillary breast.
Yeah.
So some girls are approaching to us. Actually, one of my very dear patients, she is having a axillary breast, but somehow financially they are not so sound that I can advise them for the surgery. So, what do you think? Is it necessary? Because that is for her, it is not, no problem, no pain. And meanwhile, she is coming to me regularly for the checkup also. So, what do you think? So, is it important that cosmetically we have removed that,
Yeah.
or there? Yeah, ma'am.
Now you must differentiate whether it is a normal axillary tail of normal breast, and the other is supernumerary breast.
Yeah,
Sometimes you will find supernumerary breasts with the proper nipple and all that. We have seen patients, and the mid axillary line sometimes they are found there. So if the patient is not having any issues, like it is covered by clothes and it's not causing any harm, because one must be aware that even accessory, this extra breast may have the same problems as normal breast. She might
correct. Huh,
develop lump
huh,
in that. So we
huh.
have to counsel if it is not creating any issues with her for clothing and all that. Sometimes it becomes tough, because whenever she will menstruate, she will have some mastalgia or pain in breast. And wearing clothes will become difficult, especially in axillary area. Wearing tight clothes, at times she may feel embarrassed because of protuberance in the axilla. So it depends on how much concerned she is about that. But you should be very, very careful whether it is axillary tail of normal breast or it is accessory breast. So we have to differentiate the two things.
Very true, very true. So thank you so much, ma'am. Namrata, if you have received some questions, you can take. If you have received some questions. Huh. Hmm.
Uh, very till she finds those questions, and
Huh.
sometimes we get these adolescent girls. They will say
Huh.
कि मैडम मेरा एक breast छोटा है एक बड़ा है,
Huh.
ऐसा
Yeah,
हो रहा है, तो उसको यही you have to counsel that she's growing up, and of course they will come almost to the similar size. The breast size may not be same initially, but some females are very, very concerned about this, so you have to counsel them properly. The breast size may be slightly different even in adults, so this myth has to be eradicated from their mind.
yeah, very true, very true. Yes, this is a very, very common myth. Lot of youngsters are coming to us related to that. Yeah, you can take, Namrata, the questions, what you have received.
The first question we have received is how do hormonal fluctuation across menstrual cycle impact the evaluation of breast lumps?
Oh, very interesting and intelligent question we have received. Now, as I had discussed the self breast examination or clinical breast examination, we know whenever there is menstruation, the breasts tend to become congested. So there is fluid retention. So female might feel a bit of pain in breast that we call mastalgia. Now, if we examine the menstruating women regarding breast examination, you may find some lumpiness during the menstruation or perimenstrual phase. So the ideal time to get self breast examination will be after 7 days of starting your last period. Okay. So that is a very important question because as the menstrual phase changes, the breast may feel different. So under progesterogenic effect, there are two hormones in female body, estrogen and progesterone mainly. So under progesterogenic effect, the fluid retention is there and the breast might feel lumpy and there may be some tenderness. Tenderness, whenever you will touch the breast, you she will feel the pain. So ideal time to get yourself examined is at least 7 days after your start of period or at least 3-4 days after finishing. So don't try to examine yourself during menstruation. Then you unnecessarily will get alarmed that my lumps are lumpy or they might feel different.
The
Yes,
next
very. Hmm.
question is what is your view for managing breast complaints in adolescent girls? What's normal and what is concerning?
So, normal, how normal is normal? That is important. So, it may be normal for you, it may be abnormal for me. Like one complaint I just told you, asymmetrical breasts. So, you have to counsel. Now, these young, tender age group girls, they have a lot of concerns about cosmetic issues or small breasts, large breasts, asymmetrical breasts. Then they will come with you peculiar, कि मेरा तो इसका उसकी जैसे जैसे ब्रेस्ट की आप टेंडर स्टेज करोगे तो एडल्ट वाला जो होता है उसकी डिफरेंट होता है अगर जो डेवलप हो रही होती है ब्रेस्ट द शेप इज डिफरेंट द माउंट इज डिफरेंट सो यू मस्ट बी थॉरो विद द साइंस ऑफ ब्रेस्ट डेवलपमेंट ओनली देन यू कैन काउंसल योर पेशेंट्स ओके सो इट विल डिपेंड so normal breast should ideally be symmetrical. They should not be painful. They should not be tender until unless you are examining them in the menstruation. There should not be any nipple discharge. There should not be any nipple retraction. The skin should be smooth, okay, and skin should be freely mobile over lower breast tissue. These are normal things. If you find any derangement, like there is a lump, or the skin is puckered, or it is fixed to lower tissue, or there is nipple discharge, or reddening is there, so all these things, any deviation from normal can be taken as abnormal, and you have to go to your doctor. Any
The
more?
next question,
Yeah,
yes,
one last question you can take for the infertility, then we can.
yes. Ma'am, what is your recommendation for managing borderline lesions in asymptomatic women?
Borderline what?
Yes,
Borderline
borderline lesions.
malignancy. Okay. Now, there are certain cases in which the lumps are benign. Means on biopsy it is shown that it is benign. But if it is suspicious, then you need further investigations also. Histopathology is to be done. And if the concern is either the patient has to be under very, very close surveillance or she should be advised to undergo surgery. If suppose she is living 50 kilometers away from your city, then she will not come for follow up. Then ideally, if there is suspicion, ask them to undergo surgery. That is the best option for them. Okay.
Ma'am, the
Correct.
last question we have received is what is your approach to managing breast complaints in women undergoing infertility treatment?
Now, as I have highlighted, so sometimes infertility treatment, we are giving hormones, and these hormones have effect on breast tissue also. Okay. So sometimes even a girl who is getting oral pills, I'm not talking about infertility. The oral pills which are taken as for menstrual regulation or other heavy menses. Sometimes they give these adolescents these oral pills. They may have the same kind of mastalgia as in perimenstrual phase. So these
Correct.
hormones have effect on breast tissue also because it is a hormone sensitive tissue. Breasts are having hormone sensitive tissue. So the breasts, they have effect by hormones which are being given even for infertility treatment. So we have to be very, very cautious. Whenever she's on estrogen or maybe progesterone also, I told you that it causes, sometimes it may cause congestion in the breast and patient can have slight mastalgia, that is breast pain, or heaviness for that matter.
Yeah, very true. Because yes, for the infertility treatment, whenever we give, most of the patients start complaining, ma'am, suddenly the breast is heavy, or we are feeling more soreness. These are the some common complaints. So yes, as madam has rightly pointed out. So besides that, I want to add, yes, as madam has told everything, yes, they have to increase their hydration. अभी पानी लोग इतना कम पीते तो उनको इतनी प्रॉब्लम होती है, so they have to increase the hydration, vitamin C rich diet, and rest all the things madam has already covered. So I think we have
Yeah.
to,
Yeah,
yes,
mastalgia is a very common symptom even in
yeah,
females who are not having any lump or other
correct, ma'am.
problems.
Huh.
Mastalgia may be especially perimenstrual mastalgia. So you have to just counsel her that she should wear a tight bra,
Yeah,
do some salt restriction. It helps sometimes. And we have some medications also like yoga, exercise. It all helps. And she may need to sometimes take painkiller also if she's feeling a lot of pain. Then evening primrose oil we have been using. There are so many medications which are available. So tight breast support is one very important thing which should be told to the patient.
so very true. Yeah, very rightly, madam has pointed out. Here also, I want to add one point. Yes, as we are prescribing this for fibroadenoma patient, also gamma linolenic acid, evening primrose oil. So usually the patient think that इससे कुछ miracle होना चाहिए, 10 दिन में वो fibroadenoma का lump चला जाना चाहिए. So friends, for that we are advising you the some course. You have to complete that course of the medication. It is not like a miracle that within the 2 days.
Yeah.
There is,
Even B1, B2, B6 tablets are
yeah,
available. They are
yes,
also, thyroxine is said to
yeah,
be helpful at
yes,
times.
ma'am. Yeah, yeah.
But it
So
has to be taken at least for 6 to 8 weeks, only then
yes,
it
yes, yes.
starts
So I
to.
always tell patient at least 6 weeks to ले लो, उसके बाद ही follow up का appointment लेना.
Vitamin E also
E,
has been
yes,
exhausted.
vitamin E, yes, yes, yes.
So
Yeah,
there are so many things which are
things.
there.
Yeah, yeah, yeah. So I think, madam, whatever the questions we have received, we have perfectly completed on time also. Show timing is 8:30 to 9. So thank you once again, madam, for sharing this wonderful insights with us. Yeah, over to you, Namrata.
Yes. Thank you, Dr. Ritu Santwani and Dr. Anita Rajorhia for an insightful and clinically relevant session on breast lesions and how to tackle them. Your expert perspectives have brought much needed clarity to this complex subject, enriching the understanding of many practicing clinicians. And we deeply appreciate the time and expertise you've shared with MediSage community today. And to our viewers, thank you for joining us. We hope this talk has enriched your understanding. And don't forget to explore more such expert-led session on MediSage. Stay tuned, stay informed, and stay empowered. Until next time. Good
So
night.
if there will be any further queries, you can collect them and we can have one more session, and
Yes.
Done.
we can have one more session because these complaints are very common, and we must make our women aware about breast health. That is
Under
very,
the
very.
theme. So yes, definitely we can plan for one more
And
session.
we must
Let's,
not wind up without alerting our audience that breast cancer is the most common cancer among urban population now. It has superseded even cervical cancer
cervical
in.
cancer. Yeah.
And not only women, males also, we have seen male breast cancer also. So the males are not immune to develop breast cancer. So, although very rare, but these are certain taglines I wanted to share with you all. Thank you for the opportunity, Namrata. Thank you,
Thank you,
Ritu,
ma'am.
for arranging
Thank,
everything. Thank you so much.
thank you so much, ma'am.
Thank you, MediSage. Bye bye. Good
Yeah.
night.
Good
Bye
night.
bye. So with this, we are winding off for today. Good night, everyone. Bye bye.
Good night. Good night.